Causes of missed periods that aren't pregnancy. Is your cycle late? Are you facing difficulty and having irregular cycle? Well, there are numerous causes other than pregnancy that can lead to missed or delayed periods. Missed or late periods can be caused by everything from lifestyle decisions to medical conditions. Additionally, it is completely typical for a woman's cycles to be irregular throughout two brief phases of her life. Menarche, or the beginning of menstruation, and menopause are the first and second, respectively. Although a menstrual cycle typically lasts 28 days, it is quite common for it to last anywhere between 21 and 35 days. We will examine the potential causes of your menstrual cycle being longer than usual in this video. Number 1. Stress. Stress can potentially affect the regularity of menstrual cycles in some individuals. The hormonal changes that occur during periods can be influenced by various factors, including stress. When someone experiences high levels of stress, it can disrupt the hormonal balance in their body, potentially leading to changes in their menstrual cycle. The primary hormone involved in regulating the menstrual cycle is called the follicle-stimulating hormone. Stress can affect the production and release of FSH and other hormones involved in the menstrual cycle, such as luteinizing hormone and estrogen. These disruptions can result in irregular or missed periods. It's important to note that stress is just one of many factors that can impact the menstrual cycle. Other factors such as changes in weight, intense exercise, hormonal imbalances, certain medical conditions, and medications can also contribute to irregularities in menstrual cycles. Number 2. A different sleep schedule. It's important to note that disturbances in sleep patterns such as irregular sleep schedules or significant changes in sleep duration can potentially disrupt the body's hormonal balance and have secondary effects on the menstrual cycle. Hormones like melatonin, cortisol, and reproductive hormones are regulated in part by the body's internal clock, which is influenced by sleep patterns. Disruptions in the normal sleep-wake cycle, such as those caused by shift work, jet lag, or chronic sleep deprivation, can lead to disturbances in hormone production and regulation. These hormonal imbalances may have indirect effects on the menstrual cycle, including irregular periods, missed periods, or changes in menstrual flow. Number 3. Underweight. Yes, being underweight can indeed lead to missed or irregular periods, a condition known as amenorrhea. Maintaining a healthy body weight is important for the regular functioning of the menstrual cycle. When the body does not have sufficient fat stores or is not receiving enough nutrients, it can disrupt the production and balance of hormones, including those involved in menstruation. In particular, low levels of body fat can impact the production of estrogen, a hormone necessary for the normal progression of the menstrual cycle. Underweight individuals may experience a condition called hypothalamic amenorrhea, which occurs when the hypothalamus, a region in the brain responsible for regulating hormones, becomes suppressed. This suppression can be triggered by factors such as extreme weight loss, excessive exercise, or chronic stress. When the hypothalamus is affected, it can disrupt the release of hormones that control the menstrual cycle, resulting in missed or irregular periods. Number 4. Intense activity. Intense physical activity or exercise can potentially lead to missed or irregular periods, a condition known as exercise-induced amenorrhea. This condition is commonly seen in female athletes or individuals engaging in high levels of training or strenuous physical activity. Intense exercise can affect the menstrual cycle by disrupting the balance of hormones, particularly the reproductive hormones involved in regulating menstruation. Exercise-induced amenorrhea is often associated with a combination of factors, including low body weight or body fat percentage, high energy expenditure, and increased levels of stress hormones. Excessive exercise can cause the body to prioritize energy allocation towards essential functions, such as maintaining vital organs rather than reproductive processes. This can result in an imbalance in hormone production, particularly a decrease in estrogen levels, which can lead to irregular or absent periods. However, it's important to note that not all women who engage in intense physical activity will experience exercise-induced amenorrhea. Some individuals may have different levels of susceptibility to these hormonal changes. Additionally, other factors such as diet, overall health, and individual genetic differences can also contribute to the development of amenorrhea. Number 5. Polycystic ovarian syndrome. PCOS is characterized by an imbalance of reproductive hormones, specifically an increase in androgens or male hormones and insulin resistance, and the hormonal imbalances seen in PCOS can disrupt the normal menstrual cycle. In many cases, women with PCOS may experience infrequent, prolonged, or completely absent periods. This is often due to the failure of regular ovulation, which is necessary for the normal progression of the menstrual cycle. Moreover, the cysts associated with PCOS are actually immature follicles that contain eggs. These follicles do not mature and release an egg as they should during the menstrual cycle. As a result, the menstrual cycle can become irregular or absent. So if you suspect you may have PCOS or are experiencing irregular periods, it is recommended to consult with a healthcare professional. They can evaluate your symptoms, perform the necessary tests, and provide appropriate guidance and treatment options to manage the condition. Number 6. Thyroid dysfunction. Thyroid dysfunction is another cause that leads to missed or irregular periods. The thyroid gland plays a crucial role in regulating the body's metabolism and producing hormones that control various functions, including the menstrual cycle. Both an underactive thyroid and an overactive thyroid can disrupt the normal functioning of the menstrual cycle. In the case of hypothyroidism, where the thyroid gland does not produce enough thyroid hormones, the menstrual cycle can become longer, heavier, or irregular. Ovulation may also be affected, leading to missed periods or longer gaps between periods. Conversely, hyperthyroidism, which occurs when the thyroid gland produces excessive thyroid hormones, can also cause menstrual irregularities. Women with hyperthyroidism may also experience shorter, lighter, or infrequent periods. Sounds pretty concerning, doesn't it? If you want to prevent this or suspect that you may have thyroid dysfunction or are experiencing irregular periods along with other associated symptoms such as fatigue, weight changes, mood swings, or hair loss, it is more than advisable to consult with a healthcare professional. They can evaluate your symptoms, perform appropriate thyroid function tests, and recommend appropriate treatment or management options, so don't be afraid to get a regular checkup by your nearest gynecologist. Number 7. Overweight. Obesity can cause missed or irregular periods. Excess body weight, like underweight, can affect the hormonal balance required for the menstrual cycle to function properly. Adipose tissue or body fat produces estrogen. When there is an excess of body fat, it can lead to an increase in estrogen levels. Elevated estrogen levels can interfere with the normal hormonal fluctuations and ovulation, resulting in menstrual irregularities and other problems. In addition to hormonal imbalances, being overweight or obese can also contribute to insulin resistance, a condition where the body cells do not respond properly to insulin. Insulin resistance can further disrupt hormonal regulation and lead to irregular menstrual cycles. However, it's important to note that every individual is different, and the impact of weight on menstruation can vary. Some overweight women may still have regular periods, while others may experience menstrual irregularities or missed periods. Number 8. Birth control. Certain forms of birth control can lead to missed periods or changes in the menstrual cycle. This is especially true for hormonal contraceptives such as birth control pills, patches, injections, and hormonal intrauterine devices or IUDs. These methods work by altering hormone levels in the body, which can affect the normal menstrual cycle. Some common ways in which birth control can cause missed periods or changes in the menstrual cycle include: Number 1. Birth control pills, as some of them are designed to be taken continuously without a placebo or inactive pill week, which can lead to lighter or absent withdrawal bleeding. This is known as extended or continuous cycle pill use. Number 2. Hormonal IUDs that release hormones, such as the levonorgestrel-releasing IUD, can result in lighter periods or even the absence of periods in some individuals. Number 3, moreover, injectable contraceptives or hormonal injections, such as Depo-Provera, can cause changes in the menstrual cycle, including irregular bleeding, lighter periods, or missed periods. Number 4, lastly, implantable contraceptives like Nexplanon release hormones into the body and can lead to changes in menstrual bleeding patterns, including missed periods or irregular bleeding. So there you have it, everything regarding 8 causes that may lead to missed periods. If you enjoyed watching this video, make sure to give a thumbs up and subscribe to our channel. Thank you.